Hey guys, a very good afternoon. Myself Nehal Shah, clinical dietitian, nutrition faculty and a diabetic educator. Holding master degree in food science and nutrition, masters in microbiology and philosophy in the same. Having certified for child nutrition from Stanford University and have a 15 years of experience in dietetics field. We are here to have a talk on the rarest topic of drug and nutrient interaction. First of all, my very sincere thanks to entire UNMICRC team and especially Ms. Poonam Rambat for having me on board for sharing my insights. We shall here be talking on food and drug interactions and its role in patients consuming it. So, why should we study the drug nutrient interaction? One may feel. First of all, the medicines which we take is for prevention or for the treatment of the disease. So, to make the medicine achieve its intended purpose. Second, to continue the prescribed drug as it is. Also, while taking the medicine, if there is a shift in the nutritional status, we should maintain the nutritional status. So, to check the nutritional status. And lastly, but not least, minimize the side effects and the disease complications. Now, for that, we should know how the drug works. Now, drug works according to its pharmacokinetic and pharmacodynamic properties in the body. Talking to the pharmacokinetics, it is the study of time of course of a drug in the body since we take it, involving all the processes. The first one, which is absorption, then distribution, then metabolism or the biotransformation and reaching to the sites, and after it is completed, it has to be excreted from the body. Now, talking about pharmacodynamics, it is the study of biochemical and physiologic effects of the drug and the mechanism of the drug, that is how the drug works. Often the drug molecules bind to the receptor enzyme or ion channel, producing the physiological response. Now, we shall study the type of food and drug interactions as they may be. First, by the drug effect on the nutritional status, that is the reaction of food and drug. Secondly, the food with the drug interaction, that is the effect of food in drug utilization. And thirdly, we shall study the persons at the risk of these interactions. Now, talking about the drug, as we said before, it is used for prevention or the treatment of the disease. So, what are the functions? And we should know what happens after we take the drug into the body. First of all, the first step it takes is it's dissolving in the stomach. It dissolves in the stomach and then from the stomach it passes to the intestine, and from there, from the villi, it gets absorbed into the blood, and then it reaches up to the site where its metabolism is needed. There the reaction of the body occurs with the medicine. After this reaction is completed, the final stage is the excretion of the drug by kidney or liver or by both. Here it is expected the cooperation of liver and kidney for the metabolism, excretion of drugs and toxic substances. The throughout process of absorption, distribution in the body, plasma protein binding rate, metabolism, and finally the drug excretion. That may be due to the hepatic clearance plus the renal clearance. Now, talking about the interaction. When the interaction happens, nutrient affects the active material of the medicine, thus may make it unable to work as it should ideally. Thus, the food affects the drug efficiency. We might be knowing that sometimes when we take drugs, the side effects are very common. So, we should also know the drug affecting the nutrient metabolism even. This causes effect on the nutritional status. Now, drug affecting the nutritional status, usually majority of the time it causes nausea, vomiting, unpleasant taste or dry mouth, thus lowering the food intake. In this case, certain types of medicines also may have effect of dysgeusia, that is loss of taste or smell. As we had seen in the post-COVID patients, they couldn't have the smell or taste of the food as long as 3 months or more than that. This was the effect of the drugs. Similarly, many of the drugs have such effects. Also, long-term use of both parenteral or OTC drugs may alter the nutrient use in body and may lead to vitamin or mineral deficiency. That has to be noted. Talking about the interaction of the drugs, it may affect in a different way. First, it may increase the nutrient absorption as cimetidine and ranitidine that are used for acidity. They block the release of histamines that trigger the secretion of stomach acid. Then certain drugs decrease the nutrient absorption, that is Consuming-Cne, that is used for gout treatment, alcohol, laxatives and antibiotic neomycin too. Now certain drugs cause mineral depletion too, as diuretics, chelating agents, antacids or aspirins. Now drugs altering the nutrient absorption may be by blocking the transport system or changing the pH of the stomach. It also may inactivate intestinal enzymes or remove bile salts from the sites that are required for absorption of fat soluble vitamins or reduce the microflora even. Certain drugs cause malabsorption. Example, gastric acid is responsible for freeing of the B12 in the food, and then it reacts with the intrinsic factor and is sent to the colon or in the stomach, or it is passed to the body. But in case of gastric acid reducing medicines, gastric acid is not properly made, so vitamin B12 is not freed. So it can't be free and it forms a protein bound state in the stomach and doesn't react with the intrinsic factor, thus causing the deficiency of vitamin B12. Also, as many of them might be knowing, iron absorption is improved by vitamin C or the acid in the stomach. If acid is reduced, iron absorption of the food may not be done completely, thus causing iron deficiency too. Now certain antacids which contain aluminum hydroxide can bind to phosphorus in food. Now as we know, phosphorus is necessary for many of the functions in our body. So it prevents phosphorus from being absorbed and used by bones, causing muscle weakness, and in severe cases can also cause osteomalacia and severe pain on walking. Its abuse can cause depletion in absorption of B2, copper and iron also. Now talking about the laxatives, how does they work? They decrease the absorption of various vitamin and minerals. Why? Because they stimulate motility. Thus, it causes food to move rapidly through the body, causing poor nutrition absorption. Now, certain drugs may also cause the alteration of gastrointestinal absorption of vitamins and minerals. Example, cholestyramine, which is used to reduce cholesterol in the body. It causes the inhibition of GI absorption of various vitamins. Then, increase in excretion of potassium and magnesium, also zinc, is done by diuretics, especially thiazide. Also, acceleration of vitamin D metabolism and calcium depletion is done by use of certain anticonvulsants as phenytoin or phenobarbital that are well documented. Now, drugs can also damage the exocrine pancreas. As we know, pancreas has two functions, one endocrine that manages the glucose metabolism and the exocrine that manages the digestion of fat, protein and starch. Thus, if the exocrine pancreas is damaged, the decreased digestion of fat, protein and starch occurs. Also, certain drugs that are used as appetite suppressants, example amphetamines, they reduce the appetite. It is also used for ADHD treatment, treatment of depression, or to have more energy by truck drivers to keep them awake while driving at night. Now, hunger appetite, energy, all these are balanced and is a very complex process. It involves interaction of several chemicals in brain, nervous system, pancreas, adipose tissue, stomach and the intestinal tract. Chemical hormones including ghrelin, leptin, insulin and cortisol. Neurotransmitters like GABA and serotonin. Even peptides like GLP-1. All these together, when used, these medicines either increase or some of them decrease them, thus making the person feel less hungry or feel full faster. Now talking about another cancer treatment chemotherapy drugs, that is carboplatin. It may cause nausea, vomiting, sore and dry mouth. May also get ulcers, making more likely to get mouth ulcers, thus lowering the food intake. We always have patients, those who come after chemotherapy treatment, majority of them can't eat food properly, so they tend to become malnourished. These are the reasons why it happens and they have to be nutritionally managed for the same. Now certain cholesterol reducing statins may remove bile acids for reducing cholesterol. Thus, fat soluble vitamins, as we know, as vitamin A, vitamin D, vitamin E and vitamin K, absorption is reduced. Also, certain anticonvulsant medications such as clobazam may cause the liver to increase the removal of vitamin from the body. It may also remove the vitamin D, which is important for calcium absorption. Now talking about certain medicines that slow down nutrient production. As we know, there are certain probiotics, that is healthy organisms in our body, and the pathogen when we take medicine for a certain disease. But antibiotics are taken, so it acts equally on all the organisms. It doesn't have a scanner to find out which are the pathogens or which are the helpful or the probiotics. As we know, the probiotics include so many organisms that may help in production of certain vitamins, especially vitamin K that is produced in intestines. So they are also killed. So vitamin K deficiency may occur with these antibiotics. It has to be monitored. Now medicines may interfere with nutrient metabolism even. Which are these medicines? Certain contraceptive pills, they have potential impact on key nutrient levels. They can lower the level of vitamin B6, folate in the body. So it has again to be nutritionally monitored. Now certain medicines also increase the loss of nutrients from the body. Example, diuretics like Lasix or furosemide. It removes excess water from the body. Along with the water, it increases the loss of potassium also. Potassium, as we know, is very important in proper functioning of heart and other muscles. Even aspirin that is used may cause ulcer, bleeding, thus cause loss of iron and causes anemia at the last. Medicines, certain medicines reduce food absorption. Example, metoclopramide used for nausea or vomiting increases gastrointestinal motility, thus reducing the food absorption. Others are opioids that are used in relieving pain, anticholinergics that are used for relieving cramps or spasms, decrease the gastrointestinal motility and reduce the pain. So this also affects the food absorption. Certain antibiotics such as tetracycline can reduce iron absorption too. Now we may see how food affects the drug utilization. Interaction of food with drugs. Food interferes drug metabolism positively or negatively. As delayed gastric emptying time can be done by drugs like spironolactone. Alteration of gastrointestinal pH is caused by ketoconazole. Competition for binding sites with nutrients can be done by anticoagulants and aspirin. Dejoction can cause adhesion of food or food component. Chelation of drugs by food cations is done by tetracycline. Also, dietary fats present in the food impede the absorption of hydrophilic drugs like tetraporphyrins. Ciprofloxacin causes insoluble complexes after chelated with minerals. So this has to be taken in consideration while taking. Now nutrient affects the speed. It may decrease the action of drug, it may increase the action of drugs, or can cause adverse effects too. Now absorption of the medicine is dependent on how we take the drug. Some drugs, especially when prescribed by the medical experts, they should be taken at empty stomach, as they are absorbed more quickly on empty stomach, and having food while taking such drugs may slow down the medicine absorption. Similarly, there are certain drugs which are absorbed when taken with food in a better form. Now as we know, antibiotic tetracycline, it is inhibited or interfered with the dietary calcium present in the food. Dietary calcium in the sense milk or milk products. Thus, body can't absorb the amount of antibiotic intended. Now talking about others, certain aged or fermented foods, they contain a chemical called tyramine that interact with the medication. Monoamine oxidase inhibitor, that is Zoloft, is used to treat depression and hypertension. But when coupled with fermented food or aged foods like aged cheese, fava beans, etc., it can rise to harmfully high levels due to the reaction with tyramine in these foods. This toxic reaction can lead to severe headache or hemorrhage, or even in severe cases up to death. So this has to be specially taken into consideration. Now certain green leafy vegetables, they are high in vitamin K like broccoli, lettuce, kale, spinach. They may react with anticoagulants and reduce the effectiveness of these anticoagulant medications. Example, warfarin or coumadin. It increases the risk of clotting if these foods are used. Thus, such foods should be limited and daily amount should be constant. Now talking about high fiber cereals or oatmeal, when taken in large amounts may interfere with the absorption of digoxin, that is used for improving heart efficiency or to control the heart rate. Lenoxin, which is used in heart failure with other medicines. So, if these foods are taken in high amounts, it may interfere with its absorption. So, to prevent this, elders using it should take it at an interval minimum an hour before or 2 hours after eating the meal. Now, certain acidic drinks or juices and food increase the stomach acidity, thus may destroy the medicine even, thus leading this medicine to dissolve in stomach instead of the intestine. Example, grapefruit juice. It inhibits the enzyme involved in drug metabolism and thus intensifies the effect of certain drugs. It affects a range of medicines. Example, affects certain benzodiazepines. Example, triazolam, Valium and Xanax. Even calcium channel blockers as felodipine, nifedipine and nizolidipine. Also cyclosporin, estrogen and oral contraceptives, statins as atorvastatin, lovastatin and simvastatin. Now one may feel, who is at the risk maximum by taking these drugs? Is it effective on all who are taking these medicines, or it is specific for certain people who are at more risk? Now talking to that, people who are already having a poor diet or are nutritionally compromised may have this drug nutrient interactions effect more on their body. Secondly, growing infants, as they have a very much long to go in their life run, or the children, they are also at the maximum risk. Thirdly, the pregnant women as usual are prone to especially even medicines, so this may affect them more. All the elderly are also at the greater risk. Also, people with serious health issues and taking more than 2 or more drugs at the same times. That is, maybe sometimes they may be taking drugs for non-communicable diseases such as diabetes, BP or thyroid together. They are at more risk. Also, patients using prescription drugs and OTC medications together are at more risk. Certain diseases have the drugs for a long period of time, such as diabetes. Certain people have them for 5 years, 10 years, 15 years or even more than 25 years. These long term medications, when taken for a long term, these people may be affected most by this nutrient effect. They may be nutritionally compromised more. Now, as we know, alcoholics or smokers are always prone to many nutritionally, also with the drugs, anything, they are at more risk. Also, the patients who do not follow the medical expert team directions properly are at the most risk. Now, as any topic in science is as good as a sea, and I have just tried to give a dive in this knowledge sea. Hope you find the information useful and better, and you get your best from this for the drug and nutrient interactions. After all said and done, it would be highly unjust if I don't extend my heartfelt gratitude to God for keeping me up in the inspiration of studying this valuable thing. Lastly, but not at the very least, I would like to thank the authors of the books, research papers and journals that were referred to in making this presentation well resourced. Thank you so much.